The governor of District 9125, Godi Nadi, has expressed the readiness of members of Rotary Club to help Nigerians to do well concerning their health. District Governor Nadi said this during World Hepatitis Day, tagged achieving the elimination of viral hepatitis within an evolving health system. The vaccination was held at Rogo in Abuja. Speaking at the vaccination, President of Abuja Maitama Rotary Club, Yusuf Ali, said the club is targeting 250 villagers to be vaccinated within the period. Ali encourages everyone to complete their dose of the vaccination to avoid dangers of hepatitis.
I tell you that since Sunday I have been such a very happy person, and for me that's a clear indication of the impact of Rotary when we talk about it. First was the commissioning of the bus stop at a very, very, very heavy traffic place that the people were so excited. And like I did this morning, I asked the community people whether they liked it or not, and they said that they were very, very happy about what Rotary has done. And yesterday, we commissioned a waiting area for the primary care health center in Garkitu. That one, super quality, well equipped. The nurses were so excited that the lady, when we looked at the sitting place, I could imagine how people were managing to stay there before. But by the time I left that place, I felt so that, look, we are really, really, really having an impact in the lives of people. And today, here we are. It's organized by Rotary. We are taking good care of people. And today, it's not a one-way thing, just 1, 2, 3 that we are going to do. Like the man said, if you are going to a private hospital to do a test on this, the minimum you pay is about 20,000 naira. And from what I was discussing with the chair, hepatitis, the number in Nigeria is growing. From the commentaries in the car, I was listening to what they were saying. We are getting close to about 12%, which is not good. Now you ask yourself, okay, we have done with polio, and we want to keep it there. Though the next thing is what are we doing about this? I know there are so many elements that people will talk about, but this is particularly interesting because the community is so happy about it. The medical people are very happy about the volunteers and our members, and the fact that it puts a smile on the faces of our people and the people who are getting it. The doctors are so happy that they said they are willing and ready to provide security and be with us when we do the first one, second time, and the third time. And I can tell you that I'm so excited about this. That's why I left so early. I thinking there would be traffic, but thank God there was no traffic. And for all of you, like I always say, Rotarians people don't understand that we are people, we have our own jobs, we have our own vocations, we have other things we could do. But we leave our time, we take our money, we use our resources to help other people. And as we are doing it now, other club members are doing it in so many other places. And by that, we impact the lives of people. And when the Rotary President, Jennifer Jones, talks about it, she says comfort and care. You care about your neighbor, you care about your friends, you care about your membership. And as we do that, like I always say, God will also bless us for what we are doing. And I am so happy about it, and I commend the chair and members of the committee for what they have done, and all the other committees that are doing very well. We've had so many that are doing well. I just got the one on mental care. We are going to work on the mental care issue. We've gotten the one on sickle cell disease. We are going to work on those, and I have assured them that I will get some of my friends who are involved, who have been involved in that, to support them to make sure that we create a good impact this Rotary year. And like I said, by the half year, we will have a good report to present in every aspect of it. In terms of membership, we're going to do very well by God's grace. In terms of foundation, we're going to do very well. And not only giving, we also bring into Nigeria. We've already gotten approval for about $88.4 thousand for projects in Kanu and in Zaria. And we're going to get more For the clubs that donate more, we give more. But that will also encourage others to do more. So I am so pleased, and I thank all of you who have left whatever you're going to do today to be here today. And I pray that God will continue to bless us and bless Rotary. Thank you.
Thank you. Thank you, sir. I've always done my test constantly because it's a killer disease and it's a silent killer. For this village, Rogo, we are targeting 250. In terms of resources and the capacity that we have at present, it's a thickly populated village, but we cannot accommodate everybody. Like my colleague said, it costs money, 20,000 naira per head. It's now subsidized, and that is why we are able to come here today. You are talking of a global disease. If you ask me of a targeted population, it should be all Nigerians, because nobody is immune from hepatitis B or C. You know, we have up to 5 types of hepatitis, but hepatitis B is more deadly because it has no cure, and that is why what we are doing now is preventive. We are taking preventive measure by asking them to come for test and to also take the vaccine. In Rotary, before we embark on a project, we conduct needs assessment. We met with this community, and they have been looking forward to it. They know, you can see the surrounding. You don't need to be told that communicable diseases are prevalent here. Also, this is the type of community where hepatitis thrives. And since we have located it, we even met with the chief, who confirmed that they are susceptible to hepatitis. And on the basis of needs assessment, we came here. So please let the message go out all there. What we are just doing is a token. Nigerians should come out. They should not hide. It's a silent killer. It affects the kidney. And once you are infected, then you are as good as dead. The only thing that you can do is that you go to tertiary institution where they will manage it for a while. So instead of getting death sentence, you can get it through sex, you can get it through needle. Apart from this vaccine we are doing, there will also be sensitization. We started with sensitization on how they can contract it. You go to barbing salon, and that's why the test is very, very important. There should be no stigma. Nigerians should feel free to come out for the test. No, normally if you go for hepatitis test and vaccination, like she said, it has 3 stages. You take the doses 3 times before you are fully certified as being vaccinated against it. If you do not complete the dose, then the virus, if it is in you, will germinate, and it will even be more dangerous to your health than it is initially. So please, it's always important. Help us send the message out there. Let Nigerians vaccinate themselves.
The United Nations set aside this day every year, 28th of July, to kind of reawaken our subconsciousness and remind us of this deadly disease, hepatitis, especially hepatitis B and C. And we raise awareness that people should know their status. And also there is testing, there's also vaccination. You know, it's a killer disease. And personally, myself, I lost a very close friend through this disease, hepatitis. If detected early, it's curable. So that is why there is need to sensitize our people to do the testing. If you are free of it, you go through the vaccination process. There's an advisory committee that will advise you on the stages of the vaccination. If one tests positive, then you go through a course of medication. And if this is detected early, it's curable. It's really on the rise these days. It's on the rise. I can't give you the exact figures because it's statistics, but from the medical records, it's been on the rise. That is why Rotary has come up with this program each Rotary Club or a group of Rotary Clubs will go to adopted communities and do a series of testing. But because reported cases from medical records in the hospitals is on the rise, and some will even go without really knowing their status. So people are encouraged because the figures are rising every day.
First of all, I start with the Rotary Club of Abuja. We, on behalf of the community, as a head personnel, I appreciate their coming into this community to render this service to this community. They have done a lot to us because this worth a lot. If you want to go of your own to hospital and go and do this test and take the vaccine, you spend not less than 20,000. I've come in here to offer these services free of charge to us. God will reward them, and God should also lift them from different other. They should be different from other clubs of rendering services to communities. What I have to say to the community, I appreciate the community of coming up for this process, because if you go to other communities to render such services, most people are afraid that they will not take vaccine. They thought that the vaccine is deadly. If they take, they will die. But thank God that they are enlightened and they come up in mass to come and take this vaccine. May God bless them and continue as they come to take this vaccine. My name is Dr. Damian Daba. I'm a resident of this Rogo community.
I am Joseph Agbaka by his name. We of Rogo community, we are appreciating the Rotary Club of Nigeria, the whole Africa. We appreciate them because they are saving people's life. They are saving people's life to benefit in this community. So we, the community leaders, we welcome them and we appreciate them. And we believe that for security purpose is being guaranteed. Nothing will happen. They will go home successful as they come successful. Thank you all.
Appreciating them to come in Rogo here to save the life of our people here. So God should give them the wisdom and the power to do it more for people.